Hello everyone, I am Shikaina Aquino Maranga from BSN 111A, and today I am going to conduct a health history taking nursing interview. Good morning, ma'am. Before anything else, I'd like to introduce myself first. I am Shikaina Maranga, your student nurse for today. And you are?
I am Mrs. Cherry Aquino.
Alright, and how would you like me to call you?
Just call me Sherry.
Okay, Sherry. So before we proceed, I need you to verify some of your personal information here. Your complete name, please,
Cherry Aquino.
and your age.
I am 49 years old.
Is this your address?
Yeah, that's right.
Okay, and are you married?
I'm happily married with 2 kids.
Alright, so before getting any further, I'd like to let you know that in order for me to help you today, I need to ask you some questions, particularly about your health and medical background and some of your personal circumstance. Will that be alright with you?
It's all right.
Okay. And your answers will be documented so that we will be able to formulate the best care that will suit your need.
Fine.
Do you have any questions?
No?
Okay. So let's get started. So what brings you here today in the hospital, Sherry?
Well, I come here today because I am having a problem with my severe coughing.
Okay. And how long has this cough been there for?
I suppose it's been 4 to 5 days already.
Okay. And have you got any other symptoms along with this cough?
Yeah, I had a very bad sore throat. It's very itchy.
Okay. And this sore throat, has it been there the same amount of time as the cough?
Yeah.
Okay. And does your cough and sore throat get worse at any particular time of day or night?
Yeah, it's usually very disturbing every time I'm going to sleep.
Okay. And about your sore throat, are you able to swallow with it?
Yeah, I can swallow, but there is a slight pain every time I swallow some solid food.
Okay. And can you drink?
Yeah, I have no problems with liquid.
Okay. So about the cough, can you describe it for me?
Well, every time I cough, I notice that um, there is a presence of phlegm, which is yellowish in color, and it's very sticky.
Alright. Is there any tinge of blood in the sputum?
I haven't noticed.
Alright. So on a scale of 1 to 10, 10 being the worst and 1 being the least, how bad is your cough?
Well, I suppose it's 7 to 8.
7 to 8. And do you feel any pain around your chest or your neck or anywhere else in your body?
Yeah, there's pain every time I cough, and actually, I had also slight difficulty in breathing every time I cough. I had also pain in my throat.
Okay. And can you point exactly where the pain is?
So every time I cough, I feel some very slight pain here and also here.
Okay, so the pain is in the middle of your chest and also here in your throat.
Yeah.
Okay, does this pain radiate anywhere else?
No.
Okay, so it's pretty localized.
Yeah.
Okay. And can you describe the pain? Is it like throbbing, stabbing, or squeezing perhaps, or anything?
Well, it's like squeezing.
Okay, so on the scale of 1 to 10, 10 being the worst, 1 being the least, how bad is the pain that you feel?
Well, since it's very bearable pain, so it's just 3 to 4.
Okay. And have you taken any meds to alleviate the pain? or the cough or the sore throat?
Yeah. Uh, 2 days ago, I went to the pharmacy and I bought carb-resistant Solmux. It was 500 milligrams. And also, I bought along with it uh, Strepsils. That's a lozenge. And to relieve my sore throat.
Okay, and how many days have you been taking this medicines?
I think it's already 2 days.
Okay,
2 to 3 days.
okay. And have you ever been admitted in the hospital before for any health problems?
Well, I have never been admitted to the hospital because of illness or disease, but I have been uh, admitted at the time when I gave birth.
Okay, so you don't have any other illness like diabetes, heart problems, or asthma like that?
No,
Okay, and I suppose you also don't have any maintenance medications.
no.
All right. And how about allergies? Are you allergic to anything like food or pets?
Well, I I have some allergy, particularly on nuts like peanuts and cashews, and also I have also some I got some reactions every time I eat shrimps, and I've also noticed that every time I play with my dog, I I always sneeze. So I think I have an allergy to my pet's fur.
Okay, all right. And do you know if you have any drug allergies?
Now I can remember.
Okay. And you told me a while ago that you are married and that you've got kids. And may I know how old are they now?
My eldest is 22 years old and my youngest is 18 years old.
All right. And are you still having your menstrual period?
No,
Okay. And have you experienced any miscarriages?
no.
And do you have any reproductive problems?
Well, I only had menstrual cramps at the time I still have my period.
Okay, all right. Let's proceed now to your family history. I'd like to elicit some information about your family health background. Will that be all right with you?
Yeah, it's okay.
Okay, so do you know if there is any of your first degree relatives, like your mom, your dad, your siblings, ever suffered from any jaundice? Like,
No,
okay, anemia,
I don't remember.
all right, and asthma.
Well, my mother, was diagnosed to have an asthma and she always had a severe attacks of asthma.
Okay, and what about heart disease?
I don't remember, but my father was known to have a very high blood pressure, but he he doesn't have any uh, heart problems or stroke.
Okay, and anyone with diabetes?
Yeah, my dad was diagnosed to have diabetes.
Okay, and any cancer at all?
No,
Okay, so aside from those that you've mentioned, is there any other disease that has ever affected your family?
I don't remember any.
Okay, and now I'd like a little bit of information about your social background, if that's okay with you. And so, if you don't mind me asking, what is your occupation?
Well, I am an entrepreneur and I usually work at home.
Okay, that is very nice. And are you happy with work?
Yes, I do.
All right. And have you lately been exposed to people with fever, runny nose, or cough?
Well, a week ago, my husband had a cough and he is already good.
Okay. And at home, is everything all right? No stressors?
There's no stressor except for those bills coming every month.
Okay. And how about your friends? How frequent do you see them?
Well, before the pandemic, we always get together once a month or twice. But since pandemic is here, we can't do that anymore. But we still had a connection through social media.
Okay, that's good to know that you're still in contact with them. And can I ask you, do you smoke at all?
Yeah,
And how many cigarettes do you consume per day?
I consume at least 5 sticks of cigarettes a day.
Okay, and do you consider quitting smoking?
Yeah, I consider to stop smoking because I realize that it's really bad for my health.
Well, that's really nice to hear. And if you ever decide to stop smoking, you can just come by here anytime. And we have a team designated that can help and assist you overcome smoking.
Uh,
Okay, and let's continue. Do you drink any alcohol?
I don't drink alcohol, but I drink wine
Alright.
once in a while during special occasions only.
And your diet, what kind of foods do you usually eat?
Well, I have a garden in my backyard, so I usually eat vegetables, and also I like mixing it with some pork and some like chicken also.
Okay, and do you exercise?
Well, I can't really exercise right now because lately I'm very busy.
Okay. Well, I highly encourage you to do some exercise because exercising can improve your immunity and also incorporate fruits in your diet.
Okay.
Okay, anyways, we're done with those important data. Now I'd like to sum up everything that we've covered. And if I get any error, feel free to correct me.
Okay.
Okay, so you are Mrs. Cherry Aquino, 49 years old, and you came here in the hospital due to severe coughing, itchy sore throat, and has a slight pain in the center of the chest during coughing. There is a slight difficulty in swallowing solid foods, but not with liquids. Breathing can sometimes be difficult because of the frequent coughing. You're able to cough out phlegm, which is yellowish in color and is sticky. And to alleviate the situation, you took carbocysteine solmutes 500 milligrams 3 times a day for 2 to 3 days. And some lozenges. You don't have any other illness, but you're allergic to nuts, shrimps, and dogs, which is a pet you have at home. And your father was diagnosed with diabetes and high blood pressure, and your mom with asthma. Aside from those, there are no other disease that has affected your family. And that's it. Is there anything you'd like to correct or clarify?
No, everything is correct.
Okay, so we're almost done. Now I just have to take some of your vital signs, and I'd like to listen to your lungs to hear any abnormal sounds. Is that
Okay.
okay?
It's okay.
Okay, thank you. Okay, so now I'm going to take your vital signs, your temperature, your blood pressure, pulse rate, and breathing rate. And also listen to your lungs for any abnormal sounds, okay? So here is the result of your vital signs. Your temperature is 37 degrees Celsius. Your pulse rate is 70 beats per minute. Your respiration rate is 16 breaths per minute. And your blood pressure is 120/80 millimeter mercury. Alright? So now I'll have to listen to your lungs. Okay. So, okay. I need you to breathe in and breathe out. Again, breathe in, breathe out. And one more time. Okay. And again. Okay. So I hear some wheezing sound in the lower part of your lungs. Okay, the doctor's gonna be coming in next. I'll just have to give him the results of what I have just done, and he'll come and visit you. And I'll see you after that.
Okay.
Okay. Okay. I'm back, and the doctor just told me that he heard the same thing that I've heard, and so he gave me your prescriptions, and your meds are as follows. So you've got amoxicillin augmentin 500 milligrams every 8 hours for 7 days to combat the infection, and mucosolvan, ambroxol to loosen the mucus secretions, and for your allergies, he prescribed you with antihistamine Dimetapp. Okay, so you can go home now with your prescription, but the doctor wants you to come back after 7 days for your follow-up checkup.
Okay, thank you.
Okay, so that would be all.
Thank you. I'll be back
Okay, thank you
Next.
so much.
after 7 days.
Then I'll see you then.